Hello everyone. Here I will discuss few points on our prediction of a heart disease using a data mining techniques. Heart disease is one of the most fatal one disease. This is the leading cause of death in the countries like UK, Canada and India. Impact of heart disease is so abrupt it rarely gives anyone a chance to tackle a situation. Also, it has been said that in India, every 33 seconds, one person dies due to a heart disease. So, detection of a heart disease timely and accurately is complicated and intricate process in a field of a medical. In the next slide, we will be discussing the motive of this prediction. The main motive of this research is to develop a cost-effective prediction of a said disease using a machine learning techniques. Here, cost-effective means high performance and minimum computational time. As all medical experts do not possess competence in every field, so here we will predict a heart disease on the basis of features or we can say symptoms of our patients and combine the result of this prediction along with the advice of a medical expert so as to reduce the chances of the undesirable results. In the next slide, we will be discussing the approach. Here, raw data which is collected from a multiple resources is passed as an input for pre-processing and then after this, pre-processed data is used for feature selection. As an output, we will have subset of features and this subset of features are used as an input and classifiers are applied on them to have final result. In the next few slides, we will discuss in brief the three stages to predict the heart disease. The first one was the data collection and the pre-processing. Data is collected from a multiple different sources and their pre-processing is done on a raw data by applying a data transformation and data cleansing. The transformation means to transform the data in a required form. Here, target variable which is predicting a heart disease is in having five possible values. That is 0, which means absence of a disease; 1, which means very less impact of a heart disease on a heart; 2 means less than 50% of the blockage of a heart; 3 means more than 50% of blockage; 4 means very severe impact. Here, all the non-zero values are combined to convert a multi-class problem into a binary class problem by combining 1, 2, 3, 4 into a 1, which means either presence of a disease or absence of disease. Then after that data cleansing, here few instances were having a missing values which were ignored as a result of the pre-processing. And the next we are having is dataset use. Here we will discuss the 14 features which have been used in a pre-processing stage that are age, sex, 0 for male and 1 for female. And next is CP which is chest pain, BPS which is used to represent blood pressure. Then is FBS. FBS represented as 1 if it is greater than 120 mm and it is represented as 0 if it is less than 120 mm. REST EG, which is represented as a REST electrocardiographic result, Thalach, Exang, Old Peak, CA, Slope, Thal, Num. In the next slide, we will discuss the proposed approach of a feature selection. In this, feature selection is a basically approach of choosing best subset of features which contribute best to improve the performance of a model. Here we propose a new methodology which we'll discuss in the next few slides. Further, I will discuss what are the categorization of the features. Features are classified as relevant features, redundant features, or irrelevant features. Relevant features are those features which improve the accuracy of the model, and using rest of the features we can't predict, we can't work, we can't improve the accuracy. And redundant and irrelevant comes in the same category. This contribute nothing to the improvement of the accuracy or improvement of the performance. Next, we will discuss the two models which we use for feature selection, that are SVM-RFE and gain ratio. SVM-RFE and gain ratio are used to compute score and rank of each feature individually, and the result of both the features, both the algorithms are consolidated to compute final weight by using the formula score into 1000 upon rank plus 1. Next is SVM-RFE. SVM-RFE is a linear SVM which is applied in a recursive feature elimination method. Here, recursively SVM is applied by removing the worst ranked feature in every iteration, and then the last feature which is existing is the highest have a highest rank, and the feature which was ignored first will have a least rank. In this way, we'll rank each feature. And next is gain ratio. Gain ratio is used to compute score of each feature which is obtained by dividing gain by its split info. The result of gain ratio and SVM RFE are consolidated to compute the final rate, and on the basis of final rate we will select the best prioritized best relevant features and ignore the irrelevant and redundant features. And then after choosing a relevant features from a set, we will apply naive Bayes and random forest classifiers on a subset of features which contribute best to the accuracy. Here naive Bayes is applied because it is easy to implement and it have capability to get trained even on a smaller dataset. And then additionally random forest also applied, which is a supervised learning technique. Here random forest applied in two steps. First is to create a random forest using dataset, and then is to use random forest for prediction. In this way, both the classifiers are applied to the selected features. Here, for randomly chosen features, we got the accuracy of 78% for a naive Bayes and 84% for in case of random forest. But in case when we applied a proposed methodology, we increased the accuracy from 78% to 83% for the naive Bayes and 84% to 90% for random forest. In this way, we increase the accuracy for both the classifiers. At the end, we will conclude this our topic by saying that our new methodology which we propose for feature selection improve the results by improve the accuracy by removing the redundant or irrelevant features. Thank you. Thank you for watching.